Welcome to OET Answers.
Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. How are you feeling today, Amanda? What brings you in to see me?
Good morning, Doctor. I've been feeling really thirsty all the time, and no matter how much water I drink, it doesn't seem to help. I've also been feeling exhausted, like I don't have any energy, even after a full night's sleep.
That sounds difficult, Amanda. I'm sorry you're experiencing this. Let's look into it. Besides the thirst and fatigue, have you noticed any other changes? Maybe in your weight, or how often you're using the bathroom?
Yes, actually. I've lost some weight, even though I haven't changed my eating habits. And I've been needing to urinate more often, especially during the night.
Thanks for letting me know. The combination of increased thirst, fatigue, weight loss, and frequent urination could indicate an issue with blood sugar. To understand better, I'd like to check your blood sugar level. It's a quick test. Let me get everything ready. Okay, Amanda, the test is done. Your blood sugar level is 250 milligrams DL, which is higher than normal. Typically, we expect fasting blood sugar levels to be under 100 milligrams DL, and anything over 126 milligrams DL on 2 separate occasions usually indicates diabetes. Based on your symptoms and this reading, it seems likely that you have diabetes.
That's quite high, isn't it? I had no idea it could be this serious. What does this mean for me? What do I need to do now?
Yes, 250 milligrams DL is definitely above the normal range. But the key thing is that we've identified it, and now we can manage it. Diabetes means your body is having trouble controlling your blood sugar. The first step is to start you on medication that will help lower your blood sugar levels. It's crucial that you take it as prescribed. Along with the medication, there are some lifestyle changes that will be essential for managing your condition.
I'll do whatever it takes, Doctor. What kind of changes do I need to make?
That's a great mindset, Amanda. We'll focus on 2 main areas, diet and exercise. For your diet, it's important to eat balanced meals with lots of vegetables, whole grains, and lean proteins. You'll need to be careful about your intake of sugar and carbohydrates, as they can raise your blood sugar. For example, you might swap white bread for whole grain bread and choose fruits or nuts instead of sugary snacks. Regular exercise is also important. Physical activity helps your body use sugar more effectively and can help manage your weight. You don't need to start with anything too intense. A 30-minute brisk walk most days of the week can make a significant difference.
I can start with walking. I'm not in great shape, but I can work up to more. Is there anything else I should do?
Walking is an excellent start. Just stay consistent. In addition to diet and exercise, we'll need to monitor your blood sugar levels regularly. I'll teach you how to do this at home so you can track it daily. We'll aim to keep your blood sugar within a target range, which we'll go over. Also, I want to see you back here in a month to check on your progress and adjust your treatment plan if needed.
I'll start checking my blood sugar at home and keep track of it. It's a lot to take in, but I'm ready to do what needs to be done. Will I have to manage this for the rest of my life?
It's understandable to feel overwhelmed, it's a big change. But you're not alone. Diabetes is a chronic condition, but it can be managed. With the right approach, you can lead a healthy life. We'll work together to find what works best for you, and I'll be here to support you.
That's reassuring, Doctor. Thank you for explaining everything and for your support.
You're very welcome, Amanda. I'm glad we caught this early, and I'm confident you'll do well with the right care. Just take it one step at a time. If you have any questions before our next appointment, don't hesitate to reach out. Otherwise, I'll see you in a month to review your progress.
I will, Doctor. I appreciate all your help. I'll see you in a month.
I look forward to it. Take care, and remember, we're in this together.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. How are you feeling today? What seems to be the problem that brought you in?
Good afternoon, Doctor. Lately, I've been experiencing frequent headaches and bouts of dizziness. It's been happening quite often, and it's starting to worry me.
I'm sorry to hear that you've been feeling this way, David. Those symptoms can be concerning. Have you had your blood pressure checked recently?
No, I haven't. It's been a while since my last checkup, and I haven't thought about my blood pressure being an issue.
That's understandable. Sometimes blood pressure can cause symptoms like the ones you're describing, and it's good that you've come in to get it checked. Let's go ahead and measure your blood pressure now to see where it stands. I've just checked your blood pressure, and it's reading at 160/100ths mmHg. This is quite high, David. The normal range for blood pressure is generally around 120/80ths mmHg. With your reading, it indicates that you have hypertension, also known as high blood pressure.
160/100? That sounds really high. What does that mean for my health, and what should I do to manage it?
Yes, 160/100ths is significantly higher than what we'd consider normal. Hypertension is a condition where the force of the blood against your artery walls is too high, and if left untreated, it can lead to serious health problems like heart disease, stroke, or kidney issues. But the good news is that it's manageable with the right approach. The first step is to start you on medication that will help lower your blood pressure. I'm going to prescribe something for you that should help bring those numbers down. It's important that you take this medication as prescribed and don't skip doses.
I'll make sure to take the medication. Is there anything else I can do to help bring my blood pressure down?
Absolutely, David. In addition to the medication, there are a few lifestyle changes that can make a big difference. One of the most important things you can do is reduce your salt intake. Salt can cause your body to retain water, which can raise your blood pressure. Try to avoid adding extra salt to your meals, and be mindful of foods that are high in sodium, like processed and packaged foods. Managing stress is also key. Chronic stress can contribute to high blood pressure, so finding ways to relax and reduce stress is important. This might mean setting aside time each day for activities that help you unwind, like meditation, reading, or even a hobby you enjoy. Regular exercise is another critical factor. Physical activity strengthens your heart, making it more efficient at pumping blood, which can lower your blood pressure. Aim for at least 30 minutes of moderate exercise most days of the week. Even something as simple as walking can be very beneficial.
I can definitely start with walking, and I'll try to cut down on salt. I'll also look into ways to manage stress better. Is there anything else I should be aware of?
You're on the right track, David. Those are all excellent steps. In addition, we'll need to monitor your blood pressure regularly to see how it responds to the treatment and lifestyle changes. I recommend getting a home blood pressure monitor so you can check your levels daily. Keep a log of your readings, and we can review them at your follow-up appointment.
I'll get a monitor and start keeping track. It sounds like I have some work to do, but I'm ready to take control of this.
That's the spirit. I'm confident you'll be able to manage this well. We'll meet again in a month to see how your blood pressure is doing and to adjust your treatment plan if needed. In the meantime, don't hesitate to reach out if you have any questions or concerns.
Thank you, Doctor. I appreciate all your help and advice. I'll see you in a month.
You're very welcome, David. I'm glad you came in today, and I look forward to seeing your progress. Take care of yourself, and I'll see you soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hey Jordan. Mrs. Patel just mentioned that she tried to reschedule her appointment yesterday, first online. And then when that didn't work, she called up, but apparently she couldn't reschedule. Any idea why?
I wasn't working yesterday, but let me check the notes. So Carla left a note about the call. She says that Mrs. Patel wanted to reschedule, but we didn't have any other appointments this week after 3 p.m., which is the only time she could make. She asked if she could make an appointment next week, but her procedure was marked on our system as urgent, so Carla had to make it in the same week. The system wouldn't have let her reschedule it any later. Carla wouldn't have had the authorization to change that. Still, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week.
Yeah. In her circumstance, it would have been fine to reschedule at a slightly later date. We should prevent something like this from happening again.
You're right. I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware.
Now look at question 26.
Hey, Dr. Collins. We've got the X-rays back for Mrs. Thompson in bed 6 from this morning.
Great. Can you document them in the notes?
Do you mind showing me how to write the interpretation properly?
Of course. Make sure you put the patient details, full name, date of birth, patient number, and home address first. Then put the hospital and ward, date, and time. Make sure your name is on the document too. Include the indication for the X-ray, like hemoptysis or dyspnea, before documenting your interpretation. Now, I use a simple mnemonic to make sure I don't miss anything. Example: A for airway like trachea, carina, bronchi, and the hilar structures. B for breathing like lung fields and pleura. C for cardiac information such as heart size and heart borders. D for diaphragm details like position, shape, and costophrenic angles. And finally, E for everything else like mediastinal contours, bones, and tubes or devices. Make sure you document everything clearly using this system in the notes.
Now look at question 27.
We implant an electrode array, which looks like several small wires made of a platinum iridium alloy, into different regions of the cochlea. These metal wires conduct the electrical impulses generated from the microphone, which picks up sound from the environment and sends the signals to the electrode array through a transmitter. There's also a speech processor between the two that filters more important sounds so that the patient can hear people talking rather than other sounds.
Okay. So does this restore hearing to normal levels?
No. With the current technology, we're giving deaf people a good representation of sounds from the environment and helping them understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. Not everyone benefits from the device to the same extent.
Now look at question 28.
Hello. I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test, as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
Now look at question 29.
So we've talked about different options, and it seems like a veneer would be the best treatment given the cost of the procedure. Are you happy to go ahead?
It's quite expensive, but I definitely need to get it fixed. Will it stay put?
Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable than composite bonding, and it will look more realistic too.
Oh, okay, that's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Now look at question 30.
So you say you're experiencing foot pain. Are you wearing supportive shoes?
I'm wearing appropriate shoes and I'm also wearing orthotics. That should be helping, but I'm still experiencing pain in my feet. And sometimes I feel a bit numb too.
Okay. And you mentioned that you've been given some foot exercises to do.
Yeah, the physiotherapist I went to showed me those. At first, I thought they were helping, but now I think the pain has worsened. Is there anything else we can do?
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Hello, my name is Colini Drive. Lisa Williams and I specialize in rheumatology. Today I'd like to discuss a condition that has puzzled both medical professionals and patients for years. Fibromyalgia. Fibromyalgia is a chronic condition characterized by widespread pain and tenderness throughout the body, often accompanied by fatigue, sleep disturbances and cognitive issues commonly termed as fibrofog. It's a condition that is not completely understood and is frequently misdiagnosed as other conditions like arthritis or chronic fatigue syndrome. The exact cause of fibromyalgia remains unknown, but it is believed to involve a variety of factors, including genetics, infections and physical or emotional trauma. There's also emerging research to suggest that it's a central nervous system disorder affecting the brain's ability to process pain signals. I recently treated a 35-year-old man named Tom, who had been struggling with persistent pain and fatigue for over 2 years. Various clinicians had initially misdiagnosed his symptoms as stress-related or attributed them to psychological factors. But after conducting a detailed evaluation and ruling out other disorders, we identified it as fibromyalgia. In terms of treatment, managing fibromyalgia is often multidimensional, involving both medication and lifestyle changes. Cognitive behavioral therapy. CBT has been found useful in many cases, particularly when dealing with the mental aspects of chronic pain exercise regimens. Specifically, low-impact aerobic exercises like swimming or walking also offer some relief. The psychologic and social impact of fibromyalgia can be substantial. Patients often report feelings of isolation, depression and anxiety. It's crucial to remember that while the pain is very real, it's also invisible, which sometimes leads to a lack of understanding or empathy from family and friends. For instance, in a different case, I had a young patient named Sarah, who was only 18. She was referred to me by her school nurse because her grades had begun to suffer. Sarah was often late to school due to fatigue and pain. Her family, thinking she was just being lazy or avoiding school, wasn't supportive initially. These misunderstandings can exacerbate the emotional toll of the condition. Diet and nutrition are also common topics that come up in treating fibromyalgia. Some patients report relief from symptoms after eliminating certain foods like gluten, sugar or dairy. Although scientific evidence to support this is still limited. One thing that seems consistent, though, is that a balanced diet and maintaining a healthy weight can contribute to better symptom management. Thank you for listening, and remember, if you or someone you know is struggling with persistent, unexplained pain, consider consulting a specialist with fibromyalgia. Early diagnosis and treatment can make all the difference in quality of life.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
So today we are talking to Dr. Alan Samuels, a professor of laboratory medicine and director of the Viral Diagnostics and Discovery Center in the US. Dr. Samuels, recent reports show that Lyme disease is on the rise. Why do you think that is?
You're quite right. Earlier this month, the U.S. Centers for Disease Control and Prevention reported that cases of tick-borne disease more than doubled from 2004 to 2016 and 22,000 cases to 48,000. And that Lyme disease accounted for 82% of all tick-borne diseases. Also, it's important to point out that despite the increase, it is suspected that because of underreporting, the actual number of Lyme disease cases is actually significantly higher, likely more than 350,000 in 2016. As far as why rates have increased across the U.S., one reason is globalization. People today travel extensively, and for instance, someone can get infected on the East Coast and then go back to their home on the West Coast with Lyme disease. Another reason is climate change, in that the geographic range of the tick vector has expanded westward from the northeast region of the country, as well as southward year after year.
How interesting. Non-clinical reasons driving the increase in infections.
Yes, exactly.
So how exactly is Lyme disease transmitted? And I hope you don't mind, but another related question is it contagious between humans?
So for ticks to survive the nature, they need to have what we call an animal reservoir, essentially a mammal, such as a squirrel or rodent that can harbor Borrelia burgdorferi, the bacterium in the tick that causes Lyme disease. So the cycle continues when ticks feed on those animal reservoirs carrying Borrelia burgdorferi, and then more ticks get infected. Then, the ticks can then transmit the infection to humans. Fortunately, the efficiency of transmitting the bacterium from human to human is quite low. I mean, the period during which you can find a bacterium in blood is very brief. A few days at most, and blood-borne transmission of Borrelia burgdorferi, such as by transfusion, has never been reported. The bacterium is also not excreted in other bodily fluids, such as sweat, urine, saliva, or respiratory secretions. For those reasons, Lyme disease is not considered contagious.
Well, much has been made of the difficulty involved in detecting and diagnosing Lyme disease. Is that true?
Yes, it does appear that Lyme disease is harder to diagnose. And it's primarily because Borrelia burgdorferi very rapidly leaves the blood and disseminates into the lymph nodes and into tissues. As a result, blood tests for early Lyme disease have low sensitivity.
And is it true that it takes at least 24 hours for a tick to transmit Lyme disease to a person?
Yes, that's true. The CDC recommends that patients who notice the tick and remove it within 24 hours do not need antibiotic prophylaxis with doxycycline to prevent Lyme disease transmission. The tick typically needs to be on you, sucking your blood and attached to you for 36 to 48 hours, during which time the bacteria migrates from the tick gut to its salivary glands and transmits the Lyme pathogen.
Just a moment ago you spoke about the low sensitivity of blood tests. So how accurate are the current diagnostic tests for Lyme disease?
The current approved testing for Lyme disease is a 2-tier serologic test that looks for the generation of antibodies in response to the infection. However, the key limitation of this test in early Lyme disease is that typically an infected individual may take several weeks before he or she is able to an antibody response that once an antibody response is mounted. The 2-tiered serological test tends to be very sensitive.
Is that why so many cases remain undiagnosed?
Yes, we do not have an accurate test for early Lyme disease. My lab is currently working on better diagnostics for Lyme disease. A couple of years ago, we did RNA sequencing of blood samples from patients with Lyme disease to look at the human host response. We look closely at the pattern of gene expression in patients following infection, comparing the gene signature of Lyme disease to that for control patients. We found that Lyme disease, interestingly enough, has a very distinct pattern of human gene expression in response to the infection. We are currently using these findings to develop a test to more accurately diagnose early Lyme disease and improve the efficacy of available treatment.
That is the end of Part C. You now have 2 minutes to check your answers.